A growing health scare aboard a cruise ship has sparked serious concern among medical experts and public health officials after reports emerged of a suspected hantavirus outbreak, raising alarming questions about the speed and visibility of the response from the Centers for Disease Control and Prevention, or CDC. Passengers aboard the vessel reportedly began experiencing severe flu-like symptoms including fever, muscle aches, fatigue, and breathing difficulties, symptoms that in rare cases can rapidly escalate into a deadly respiratory illness known as hantavirus pulmonary syndrome. The virus, which is typically spread through contact with infected rodent droppings, urine, or saliva, is extremely rare but highly dangerous, with a mortality rate that can reach nearly 40% in severe infections. As panic spread among travelers and crew members, health experts across the United States began openly asking a troubling question: where is the CDC? Critics argue that while isolated outbreaks on ships are not uncommon, the apparent lack of immediate public communication and visible federal coordination has created confusion and fear at a time when transparency is critical. According to reports, several passengers were isolated after showing symptoms, while medical teams on board attempted to trace possible exposure sources throughout the ship, including storage areas and food supply sections where rodents may have been present. Some epidemiologists believe the confined environment of a cruise ship creates unique challenges because passengers share dining spaces, ventilation systems, and recreational facilities, increasing anxiety even if hantavirus itself is not generally spread person to person in most cases. The incident has also reignited memories of the COVID-19 pandemic, when cruise ships became symbols of rapid disease transmission and delayed containment measures. Travelers on board reportedly described chaotic scenes as rumors spread faster than official updates, with some passengers demanding to disembark immediately while others questioned whether they had been fully informed about potential health risks before boarding. Meanwhile, infectious disease specialists say the most important factor now is identifying the source of contamination and determining whether the reported cases are confirmed hantavirus infections or another illness with similar symptoms. Still, the silence from federal agencies has become a major part of the story itself. Public health analysts appearing on television and online platforms have criticized what they describe as a lack of urgency in public messaging, arguing that even a small outbreak involving a rare virus should trigger rapid national attention because of the severe nature of the disease. Some experts warn that delayed communication can fuel misinformation and public distrust, especially in an era when social media speculation spreads instantly. Cruise industry officials, however, insist they are cooperating with health authorities and taking aggressive sanitation and containment measures, including enhanced cleaning operations, medical monitoring, and possible quarantine protocols. Still, the silence from federal agencies has become a major part of the story itself. Public health analysts appearing on television and online platforms have criticized what they describe as a lack of urgency in public messaging, arguing that even a small outbreak involving a rare virus should trigger rapid national attention because of the severe nature of the disease. Some experts warn that delayed communication can fuel misinformation and public distrust, especially in an era when social media speculation spreads instantly. Cruise industry officials, however, insist they are cooperating with health authorities and taking aggressive sanitation and containment measures, including enhanced cleaning operations, medical monitoring, and possible quarantine protocols for affected individuals. The company operating the ship has also faced mounting pressure from passengers, families demanding answers about safety procedures and emergency preparedness. At the same time, health professionals emphasize that hantavirus outbreaks remain extremely uncommon and that the average person's risk is still considered low, especially when proper sanitation and rodent control measures are maintained. Nevertheless, the situation has become a flashpoint in a larger debate about America's public health readiness and whether lessons from past outbreaks have truly been learned. With investigations continuing and passengers anxiously awaiting more definitive answers, many experts say the next few days will be crucial in determining whether the outbreak can be contained quickly or whether it could expose deeper weaknesses in outbreak response systems. For now, the mysterious illness aboard the cruise ship has transformed from a medical incident into a national conversation about trust, transparency, and the role of public health leadership during moments of uncertainty.